pleasure to introduce Kim, and she's going to kick off session 1. It's all yours, girl.
All right. I think I need to go. Really happy to see some new faces. Met some new folks this morning asking me questions that I'm not smart enough to answer, but we've got the people in the room who can. Really proud to be here at our 18th annual conference. As Linda mentioned, I've been very blessed to be part of this organization since the beginning, and would also like to recognize and honor my deceased stepfather, William Shields, who was one of the reasons why we founded ADAO. We lost him in 2004. And my ex-husband, Doug Larkin, and Linda met, not knowing they were going to be forces to change the world, and here we are today. I feel old, almost 20 years later. It's not quite 20, is it, Linda? 2024? I guess it is almost 20. So thank you so much for coming. You know, when I was listening to the presentation about this beautiful building and the past, what a great segue into this first session. Many of you may know that Dr. Selikoff is really the founding father for everything that we've done. He is the reason why we are having this conversation today, and the work that he has done in the past is shaping what we're doing in the future. So really happy to be able to moderate this important panel with our esteemed members of our ADAO Science Advisory Board, who are going to dig more into his work and how that's taking us forward as we go into the future and continue this great work. So let me introduce our panel quickly. I'm Dr. Richard Lemen. He is our co-chair of our Science Advisory Board. He's a retired Assistant Surgeon General of the United States and served as the acting director and the deputy director of the National Institute for Occupational Safety and Health. I'm not going to go into, by the way, long bio descriptions for all of these folks because they are long. So I encourage you to look in your programs and read more about their esteemed careers. Also want to welcome Dr. Arthur Frank. He serves as Professor of Public Health and Chair Emeritus of the Department of Environmental and Occupational Health at the Drexel University School of Public Health in Philadelphia. Also want to welcome Dr. Christine Oliver. And she is an adjunct professor in the Division of Occupational and Environmental Health in the Dalla Lana School of Public Health at the University of Toronto. They all have so much to talk about. They are well-published researchers, authors, and speakers on this topic, and I know they'd be happy to also answer your questions if you have any at the end of the panel. So I'm going to now turn it over to Dr. Richard Lemen, who's going to kick us off.
Good morning, and welcome to the 18th International Asbestos Disease Awareness and Prevention Conference. I'd like to share a short story with you in honor of two colleagues. Both have already been mentioned in our fight, and I say fight because we have been fighting this evil pandemic of asbestos-related diseases for years. These two colleagues that I mentioned are Dr. Irving Selikoff, who we lost in May of 1992, and journalist Paul Brodeur, who passed in August of this year. My short and condensed story begins in 1971, when I and several other U.S. Public Health Service officers from the National Institute for Occupational Safety and Health went to a town in Texas, Tyler, Texas, to do a field survey of an asbestos thermal insulation plant where we measured airborne concentrations in the magnitude of 15 to 20 times the current standard for asbestos. Medical examinations conducted at the plant demonstrated approximately 50% of the current workers employed for 10 or more years had asbestosis, while a significant number of those individuals employed for less than 10 years exhibited symptoms and signs consistent with the early development of asbestos-related diseases. Furthermore, we found potential for community exposure to asbestos when it was discovered that indiscriminate dumping of asbestos waste by the plant had occurred in large areas of the community. It was also found that burlap bags, once used for shipping raw asbestos from Africa, had been sold to local rose nurseries for use in wrapping rose bushes shipped throughout the United States and the world. Tyler, Texas at that time was considered a rose capital of America, as anyone could tell when driving into Tyler, since a large billboard erected by the People's National Bank of Tyler read, "Life is a bed of roses." You'll have to ask Dr. Frank if it really is a bed of roses in Tyler, Texas, and he'll probably talk a little bit about his time living in that city. By February 3rd, 1972, the Pittsburgh Corning plant in Tyler, Texas had closed. This drew the attention of investigative reporter Paul Brodeur, who attended a press conference held by Tony Mazzocchi of the Oil, Chemical, and Atomic Workers Union, who represented the employees at the Tyler plant. Brodeur then visited the plant in Texas, which now was being kept under armed guard by Pinkerton guards hired by the Pittsburgh Corning Company to keep people away, while 62 employees in the plant were scraping the asbestos off of machinery in order to take it down and bury it in disposal areas around the community where the plant had already been disposing its waste asbestos for some 17 years, since the plant moved from Patterson, New Jersey to Tyler, Texas in 1954. In 1951, a few years before the Tyler plant moved to Texas, Dr. Irving Selikoff, a chest physician at the Mount Sinai School of Medicine in the City University of New York since 1947, was participating in research on isoniazid, the antibiotic that was found to kill tuberculosis bacilli. Providing a cure for tuberculosis was a thing that Dr. Selikoff worked on for many, many years. In 1953, Dr. Selikoff opened a medical clinic in Patterson, New Jersey, the same city where the predecessor plant in Tyler, Texas was located. Dr. Selikoff identified at that time 17 workers coming to his new clinic suffering from what he described as showing lung defects rarely seen without exposure to asbestos. By 1961, 6 of these 17 had died. Dr. Selikoff then asked the president of the company owning the Patterson, New Jersey plant if he could see the workers' records so he could undertake an epidemiological survey of all workers in the plant. The company president refused Dr. Selikoff's request. Selikoff then went to the state health department and again was refused access to records that would help determine how extensive a problem might be from asbestos. Unable to obtain records, Dr. Selikoff did something that had never been done before. He contacted the unions representing workers that were installing asbestos thermal pipe insulation and working with other asbestos products. The unions for years had been asking for someone to come study their workers. Dr. Selikoff was more than willing to study those workers, and it's from his work that we are able to understand what is going to happen possibly in Tyler, Texas, and what is continuing to happen in many other parts of not only the United States, but the world. Knowing of Dr. Selikoff's work, we at NIOSH came together with him and talked about his studies in New Jersey. And he mentioned to us not only were the workers getting sick, but the family members were getting sick. And the data allowed us to predict that in this small plant in Tyler, Texas, some 200 excess deaths would occur after 20 to 30 years if nothing was done. So we planned studies to put together intervention programs which could be placed in critical areas where asbestos was found throughout the United States. An innovative epidemiological approach to intervention in this pending epidemic of asbestos-related diseases we were just beginning to explore in Tyler, Texas, was what we were intending to do at this time. And in conjunction with the National Cancer Institute, the East Texas Chest Hospital, and NIOSH, we set forth to locate the workers that had ever worked in the Tyler plant, as well as their families. There were 875 such workers, and by November the 6th, 1973, when I presented a paper authored by myself, Dr. Selikoff, Drs. Wagner and Johnson, my colleagues at NIOSH, to the American Public Health Association 101st meeting in San Francisco, we had located 90% of all the past employees, and with further shoe leather epidemiology and tracking, we were hoping at that time to locate the majority of the remaining 10%. Dr. Selikoff and his team, when evaluating family members in the New Jersey, found close to 40% exhibited radiological abnormalities consistent with asbestos disease exposure. Some of these asbestos abnormalities were not just in the workers, as I mentioned earlier, but in the family members. And we were in very early stages of the community epidemic in the making in Tyler, Texas. The overall latency for both family members and workers at that time was only 16 years, when asbestos-related diseases usually take at least that amount of time and usually much more. Unfortunately, while we have not gotten a ban on asbestos in the United States, similar studies and interventions are often still necessary. It is fortunate that the passage of the OSHA Act in 1970, which gave us at NIOSH and OSHA the right of entry into plants throughout the United States, allowed us to enter the Tyler plant and uncover this potential disaster. I would like to end by saying that the Tyler plant is still under surveillance. I don't know if Dr. Frank is going to mention anything about it, but however, if we can get the Alan Reinstein Ban Asbestos Now Act passed, stories such as this would remain as history and not continue to make history. And I noticed that Earl Dotter had a poster with Paul Bredeur's book in it, but I would like to recommend any of you that have not seen this book to try and get a copy. I don't know how available it is, but this is a book called Expendable Americans. It's about Tyler, Texas, and it's dedicated to the workers of the Tyler plant, and it was published in 1973. Thank you very much.